Colonoscopy is a very important screening tool to bring people with precancerous lesions to attention. Colon cancer is one of the few diseases that we can pick up early or pick up in the precancerous stage so that we can remove those lesions and prevent a poor outcome for the patient. Bowel cancer is very common in Australia. 1 in 18 men get a bowel cancer and 1 in 24 women. Bowel cancer is usually something that presents over age 50, but I have had cases down into their 20s, 30s, 40s, depending on particular familial syndromes. Well, I believe that people should have a screening colonoscopy over age 55. If someone has a family history of bowel cancer, then we screen those affected relatives every 5 years or 10 years earlier. For example, if someone had a premature cancer at age 50, then we would start screening their siblings or children at age 40. There's a long lag time to make a cancer. It's about 8 years. So if you do a colonoscopy every 5 to 7 years, you have plenty of opportunity to remove that polyp whilst it's still benign, preventing a patient's probable malignancy. The government sends it to everybody over age 55 every couple of years. It's a very easy test to do at home. That screening test is called a fecal occult blood test, and it's like a dipstick test where the patient can test for blood in the stool at home. And that's important because it gets people to the real screening test, which is colonoscopy. It brings a lot of people to screening years before their precancerous lesion might otherwise become a symptomatic or a prognosis problem for them. Only about 40% of patients will actually perform the fecal occult blood testing when that test kit arrives, which is a shame because it's an extremely effective tool in bringing people to colonoscopy. But for those people who do that test, it's very beneficial. The vast majority of lesions can be removed at colonoscopy, even early malignancy, and that's another advantage of colonoscopy because it's not just a diagnostic tool, it's also a therapeutic tool. So very few patients we actually have to refer on to a surgeon to remove, and therefore more advanced lesions.
Care to Share, brought to you by Budrum Private Hospital, because your health matters.